Welcome to the Better with Age podcast, where we discuss all things to improve your health as you age. I am Leah Wetzel, licensed nutritionist and certified nutrition specialist. And today's guest is Creekside Physical Therapy's pelvic floor specialist, Mandy LaBrosse. Mandy received her doctorate of physical therapy in 2006. After returning to Minnesota in 2010, she joined the P2SI team and worked with Galen Wetzel and Mark Bookout, where she gained invaluable experience treating spines, orthopedics, headaches, TMJ, and complex pain in patients. And in 2019, she received her Certificate of Achievement in Pelvic Physical Therapy from the APTA. I hope you enjoy the show. All right. Great to have you today, Mandy. I'm excited for our topic at hand, and I appreciate your willingness to come on and share your expertise and your background. And with our audience and also at our clinic, we're super excited to have you join Creekside. So tell me a little bit about your background.
Yeah, I went to physical therapy school at Chatham University in Pittsburgh, and I graduated in December 2000. And I actually I worked for a couple years in Pittsburgh before here. I'm from Minnesota, and so that was kind of the natural move after we were done with college. And started working for P2SI, which is kind of how Galen all this started at Creekside. So it's really fun to kind of loop that back in. But
yeah.
And then I started doing pelvic health probably about 11 years ago. I took my first pelvic health class, and then I went on to get my Certificate of Achievement in Pelvic Health from the APTA, and that was in 2020. And I've been treating pelvic health ever since. So it's definitely a big area, a big passion for me.
Yeah, I'm super fascinated by this as a middle-aged female who has had children, right? Two big babies. I had big babies. And honestly, other than some basic things I worked on with my midwife post birth, I had never really dug into this. And the more I learned about the importance of pelvic floor health and also working with women as they age and how that becomes more and more of an emphasis, I realized it's something that I shouldn't take lightly and gathering information. So today's topic at hand is really a lot for me to learn and also to explore, as far as I look at therapies around that. So what is pelvic floor health? Why should women, especially as we're getting older or even like postpartum, right, too? I think seems like an important window to take that seriously. But how does that play a role in our health and keep us strong and healthy as we get older?
Yeah, that's a great place to start. The pelvic floor, I feel like, is this kind of taboo topic, and I feel like it's becoming less, so I'm really excited about that. But I feel like everyone just kind of shies away from the pelvic floor. But it's just a group of muscles that make up the bottom of the pelvis. And so the primary functions are bowel and bladder health, stability, support. Demystify it, they're just muscles. They're muscles like the rest of the body. And so we need to treat them like muscles in the rest of the body. We need to make sure that they're strong, that they're not tight, that they're doing what they need to do. So I think the hard thing with pelvic floor is that because they are such internal muscles that we can't see when they're working. We can't see if they're working right. 50% of women do Kegels or pelvic floor muscle contractions maybe wrong, but not as effectively as they can because we can't see that motion. And so that's what makes the pelvic floor, I think, just a little bit more challenging, but also more of that taboo, right? They're internal muscles. And so everyone's just kind of we'll just set them over here and kind of avoid them. But yes, I think, talking about the postpartum, that is definitely what got me started in this. And so when I took my first course, I was about 6 months postpartum with my second son. And I knew the body, right? I knew the pelvic floor. I wasn't doing a lot of pelvic floor. But I went to that course and I found out that I had pelvic floor dyssynergia. So when I thought I was contracting the muscles, I was bearing down. When I
Mm.
thought I was bearing down, I was contracting. And I had no symptoms, which was awesome. But after that course, I have no doubt that I would have developed probably urinary incontinence, possibly pelvic pain, maybe constipation. And so I just became so passionate that, I mean, so many women have children and a lot of them do have symptoms. And we just kind of hear like, oh yeah, you had kids, it's normal. Like it's just what happens. Or there's a lot of women who don't have symptoms, which is great, but maybe they have some of these things that are going on and we can help. Maybe they don't ever need to have symptoms. I see a lot of women who, have had kids, they do really well. Their body's really good at compensating because their bodies are. And then postpartum, or excuse me, menopause hits, they get a little bit of atrophy. There's a little more things going on, some hormone shifts, and all of a sudden they have all these symptoms. And I fully believe that had they been helped postpartum, they may never have developed those symptoms. So I think it's so important to see a pelvic health provider postpartum. Europe, their like postpartum care is 6 to 12 visits for every mom postpartum.
Wow.
So we are behind. But I mean, I am passionate about postpartum. That's kind of like where I live and love, but it's not just for women who have had kids either. I mean, I see a lot of women who've never had children who have these symptoms. I see a lot of men who have symptoms. And they develop for a variety of reasons, but I think it's just so important, just like every other muscle in our body, to keep functioning well. I think urinary incontinence is one of the top reasons that people get admitted to nursing homes. And so
Mm.
I think there's just so many things that we can do earlier to help prevent some of those things from even happening.
That's great. Yes. You said a lot of really important things there. And I think one, and this was a question I had in my brain, and I've seen clinically too, like you don't necessarily have to have a baby in order to have issues, right? Because I've had women in my practice where they've never had children, but they have pelvic floor issues going on.
Absolutely.
So, yeah, I think that's really important thing, and that as far as trajectory, like it's great, if we are getting that care postpartum, but let's say we don't, right? And we're now in our mid 40s. Is it ever too late? Like at any stage, can we make change and correct and fix maybe if there's dysfunction going on, the patterning, can you fix
Yeah,
that? Or
absolutely. I
yeah.
mean, I think just like anything else, right? The earlier we see it, usually the easier it is to treat, right? But yeah, I mean, I help women, like I said, who, had kids, maybe didn't have symptoms or maybe had symptoms all along. I mean, I see women who have just leaked with laughing since they've had kids and now 30, 40 years later, it's gotten really bad and now they're wanting help. And so I think any age, and I think it's really important. I mean, I saw a woman, actually it was really fun. She did not have children, but she had been leaking since with like laughing, coughing, sneezing for like 20 years. Super common symptom, especially postpartum and after having kids. But a lot of women who don't have kids have these symptoms too. And we have what's called a cough reflex. So when we cough or sneeze, our
Mm.
pelvic floor should naturally contract. That's what keeps us from leaking. And it's something that we don't have to think about usually. But if that cough reflex isn't working, that's when we lead to leaking. And so I see a ton of women who've had kids where this cough reflex just never kicks back in. But this woman, like I said, didn't have kids. And all we did was work on that cough reflex. I saw her for maybe 3 or 4 visits and she was leak free
Ah,
and had been leaking for 30 years. So, yeah, I mean, it's never too late to work on symptoms.
yeah, that's awesome. And kind of getting into that. So like leaking is a common symptoms, but I think there's also, from my understanding, some uncommon like things you wouldn't maybe always associate with pelvic floor health that could be connected. What are sort of symptoms or connections to pelvic floor health if things aren't balanced?
Yeah, that's a great question. I mean, yes, leaking is probably the most common one. Urinary frequency is one that I feel like a lot of people don't really recognize or think about unless it gets really bad. But we really only should need to urinate about every 3 to 4 hours, depending on what our intake is. And so I see women who are like, oh, but I go every 1 to 2 hours. Like, isn't that normal? No, not really. I mean, our bladders have a pretty big capacity, but we can train our bladders to feel like it needs to go more often. And pretty soon it's a habit, just like every other bad habit. And so that's a big one that I feel with people. Frequency at night is another big one. I mean,
Mm.
really, until about the age of 55 or 60, we shouldn't have to get up in the middle of the night to go. And so a lot of people do. So that's something we can work on. Constipation is another really big one. The pelvic floor plays a huge role in constipation. Sometimes the cause of constipation, sometimes the pelvic floor gets affected because of chronic constipation. Um, Another one that I feel like is kind of no one really pays attention to is like chronic hip pain. So obviously there's a lot of things that lead to chronic hip pain and it can be more orthopedic, the hip itself. But I see a lot of women who have done all the orthopedic things. They've had scans, they've seen a PT for their hip, and it doesn't get better. And then we go and we check those deep hip rotators that we can access through the pelvic floor, and they're really tight. And so working there can help hip pain, painful intercourse, or just any pelvic pain. So yeah, there's so many symptoms that come from the pelvic floor.
Yeah, the constipation, like in my practice, because I work
Yeah,
as a nutritionist and I see that, constipation profile. And that definitely I've seen for patients with chronic constipation. It's often maybe many layers, but like where pelvic floor health played a big role in their symptoms and correcting those issues where
yep,
that's resolved. Yeah, that's really fascinating to me about all the mechanics around that. And also like other body systems, like I always think of like body systems
yep.
too. Like what other parts of the body are connected to pelvic floor? Like,
Yeah, I mean, I all of them.
ah,
You know, it really is a full body approach system, however you want to look at it. Like everything affects everything. And so, I mean, I one big connection that I see a ton is that we've got a lot of fascial connections from our jaw to our pelvic floor. So I often see people who they come in maybe for pelvic pain. And I'm like, what about jaw? And they're like, oh yeah, I like grind and clench, and I do have some jaw pain. And so I've treated patients just for their jaw, and their pelvic floor symptoms have gone away. Then it's maybe someone who doesn't want to do internal pelvic floor, and so we don't go there. But we work the jaw and things improve. And so I think it's all connected. Posture is another huge one. I mean, our posture can affect everything, including the pelvic floor. So if we're not set up with good posture, that puts different load on the pelvic floor, which can lead to things. Um, Mental health is another huge one. I feel like
ah.
that gets overlooked a lot,
Yeah, tell me
especially
more
when
about that.
yeah, especially when I treat like painful intercourse. That's a huge one. There's almost always more kind of a mental health component to it. And so I often send patients to sex therapy at the same time that they're doing physical therapy. But I just feel like our brains are so powerful and they really help regulate everything. And usually things are great, right? But if problems like that can lead to a lot of things, it can lead to chronic pain, it can lead to gut issues, it can lead to sleep problems, and we need our sleep to recover. So, yeah, I feel like every system really needs to be addressed, regardless of what we're treating, but the floor is no
Yeah.
different.
Oh, for sure, for sure. Yes. And, like you talked about, and I will confess, like, a lot of the symptoms that maybe I always says are fairly mild at this point of, and I'm in, the middle of perimenopause, I would say. But for women in this realm, perimenopause and menopause, and the shifting of hormones that happen, like it seems to me, and you would know best, that this is the window where if things aren't good, right, that things start to show up. And hormones play a role too, I'm guessing. But what is it about this life cycle where all of a sudden now maybe something that was minor now becomes major as far as a symptom, pelvic floor?
Yeah, I mean, I am no expert at hormones, but we all know that hormones shift with perimenopause and menopause. Estrogen drops. There's a lot of symptoms that come with perimenopause, right? Hot flashes and all of those things. And so when you think about the pelvic floor, atrophy. Atrophy is another big one, right? We see women a ton of muscle strength. Well, the pelvic floor is no different. And so I see a lot of atrophy in the pelvic floor. I see a lot of vaginal dryness, and that dryness is like painful intercourse, incontinence. And so, yeah, I think, our bodies are really good at compensating until they're not. And so I feel like, we may be able to get through our 20s, 30s, and even into the 40s and not have problems, even though maybe there's some deep underlying things going on. And then we start to see these hormone shifts, and all of a sudden our body's like, oh, this is too much. And then things start to fall apart. Um,
Yeah.
so, yeah, I do feel like that period tends to be a big one for the pelvic floor.
Yes, yes, definitely. Yeah. And, as far as looking at things around longevity, like what you had noted, like urinary incontinence becomes such a big issue as we age, potentially, not necessarily, but
Not
potentially.
necessarily. Yep.
Yeah, so I mean, it almost seems to me like as far as preventative wellness that most of us should be just assessing things. I know it's a hard for a lot of women. I found like they find this sort of therapy maybe uncomfortable. But in general sense, going through it, like well worth the process. And often on the other side, like it wasn't as big of a, challenge as they made it in their head. Like
Yep.
going through pelvic floor therapy, like what are people to expect in context
Yeah,
still?
that's a great question, and I love to put this out there because I feel like I get so many people that come in for pelvic PT. Their doctor sent them. I'm like, "Do you know what you're getting yourself into?" And they're like, "I have no idea." And so I feel
Oh.
like that's what some of the anxiety I think comes from is that they just really have no idea what to expect. And so I think if providers were able to give a little bit more detail of like, this is what you can expect, or like, check out this link, that anxiety might be a little bit less. But yes, I think, because it is such a sensitive area, every visit, everyone might look a little bit different. Because I do, patients are comfortable. And so I'm not, my first visit may not look the same with someone who's coming in for pelvic pain as it might with postpartum incontinence. The first thing really is just a great history. So just like going to the doctor, I want to know kind of all your past medical history. Certainly if it's postpartum, what were your pregnancies and deliveries like? Any surgical history, especially abdominal stuff. So kind of that general subjective. And then because I do really kind of do a whole body approach, I kind of look at everything. So I want to see what's your posture? How are you breathing? What's your spinal mobility look like? What's your range of motion? What's the strength of the abdomen and the glutes and all of those things? Full body assessment that you'd probably if you went to a is more that pelvic floor. And so look a little depending on the patient. Ideally, a good internal exam, whether it's vaginal or rectal, is how we're going to assess those muscles to the best that we can.
Hmm.
And so that obviously is kind of where that sensitive nature comes in. And so, like I said, they're same muscles as anywhere else in the body. So I want to see, is there tightness there? Are there trigger points? Is there pain? Can you find those muscles? Like I said, 50% of women can't do Kegels correctly. So do you know how to get that muscle to contract? Can you muscle? However, that said, if someone's not comfortable with an internal exam, we're not internal exam. So there's other ways to assess the pelvic floor. We can do it externally just through palpation. We can do something called biofeedback where we kind of take these little sensors that go externally around the anus that can put the activity of the pelvic floor up on a computer screen. So that can give us a good sense of kind of what the pelvic floor is doing. Or just kind of talking the patient through it, right? So when I floor contract, kind of a squeeze and a lift. And that most patients don't do it right comes from because they don't always get that lift component. So if you're sitting on a surface like a hard chair, you kind of be able to feel your pelvic floor pull up and away from that surface a little bit. So that's the way we can kind of just talk. Can you feel that lift or can you not? Can you hold that contraction? So there's a lot of ways that we can get at least a good understanding at the pelvic floor without doing that internal.
Right. Yeah, yeah. That's great. That and like you had talked about, like even like working on jaw, like the whole body's interconnected.
Yeah,
It sounds to me that there's so many different layers of tools that can be used, right, to that person's comfort level,
absolutely.
and can be beneficial, right?
Very beneficial. Yeah.
Yes, yes. I think that's really great for people to hear because I honestly there are so many women that I work with and that like it's on the back of their brain,
Yeah.
right? Right? Like me.
Yeah. Right.
And I haven't
Are
followed through
mild
yet.
like that, right? It's easy to be like, oh, it's not that big of a deal. Like, if it gets worse, I'll go in, and then it gets a little worse, notice, and then pretty soon it's a bigger issue.
Right. Right, right, right. And just yeah, not even really fully knowing if I'm doing things correctly. I think one interesting thing that I'd heard, and I'm curious about this, because there's a lot of talk about how the muscles around this area in this context are uh, too weak, right? And that so women focus on trying to do those Kegels, but I've also heard from professionals that it's a lot of too much tightness, actually,
Hmm.
which is kind of misconstrued of what we maybe think about when we think about dysfunction around the pelvic floor. Can you help disseminate that? Like,
Yes, I'm so glad you brought this up because I do feel like this is a huge thing, right? It's really our health system is set up that like we often try to treat ourselves, right? And there's so much on social media, and I'm like, oh, I'll just follow this pelvic PT and do what she tells me to do on her Insta. Things will be fine. And usually most of that is strengthening, right? And so I think it's so hard because my default is like the benefit of exercise usually outweighs any kind of negative side effects, right? We just want people to move and be active. But you can do too much strengthening in the pelvic floor, right? If the pelvic floor is tight, which is super common when we have a lot of tension here, it's super common if we've had some chronic pain anywhere in the body, right? We hold tension in the pelvic floor just like we hold tension potentially like in the jaw. Postpartum is another big one, right? There's a lot of trauma that happens to those tissues. And so our bodies, like I said, are good at compensating. And so that compensation sometimes is like, we need stability, we're going to tighten up. And
Mm.
then that chronic tension's there, and all you're doing is trying to strengthen, and you're just making that tension worse. So I do really feel like that's where seeing someone, right? And maybe it's only one or two visits, right? A lot of patients are like, oh, I can't afford it, or it's too hard to get there. But just having at least a pelvic floor health assessment and see like, are things tight? Are they weak? Is it both? Both is a common thing.
Yeah, the both
Um,
thing that's complex.
yeah, and it really, I mean, it seems counterintuitive, right? Like it should be one or the other, but I think, and sometimes it's not even like true weakness. What I see a lot of is people who hold a lot of tension there, those muscles are just fatigued. So like if you're holding extra tension, think about like your biceps, right? If I walk around all day and like hold something, I probably have some good strength, but when I need them to work, like those muscles are fatigued. The pelvic floor now hard, and it's like, whew, I'm giving up. I've held long, I can't do it. It is big tension piece. And if we can get those pelvic floor muscles to relax, like when you're sitting at rest, those pelvic floor muscles should be chilling out. Like you shouldn't feel like you have to hold tension there all the time. But a lot of us do that without really even realizing it.
Yes, like yeah, just innately,
Yep.
right? Yeah. Yeah, that is great. I mean, again, going into like why it makes sense to like get assessed, so you know.
Right. Yes.
What are some
If
like
only everyone just come.
right,
But I
exactly.
really postpartum, I think that like I've already
Oh
mentioned, like
yeah.
that is my passion. Like every woman, just send them to pelvic PT. Like let
Yes.
them be seen at least once and just make sure things are where they should be and you know how to find those muscles. And
Yes. Yeah. And like you said in Europe, I did not know that in
yeah,
Europe the practices they get 6 to 7,
6 to 12.
6 to 12
Yeah.
visits.
I mean, they have universal health care, so it's all covered. But yeah, every woman, I mean, I don't know that everyone goes, but that's like the order. Every woman, 6 to 12 visits, go see a pelvic physio. And
Yeah, totally makes sense to me. So for those of us interested in maintaining good pelvic floor health, what are like some simple like maybe daily practices or movements that you'd recommend for somebody, to keep your pelvic floor healthy, especially,
yeah.
for people that like who want to stay active. I love being active, right? Like
Yep.
and that's a huge part of my well-being. And so anything I could do to stay active and healthy is really important to me.
And I think that's a, and I mean, first, like we've already mentioned, see someone first because I don't want you to be
Yes.
size, right? Um, Make sure you kind of know what's going on and you're focusing on the right things, but really activity. I mean, the cool thing about the pelvic floor, very similar to our core, is that when we're active, the pelvic floor is active. And so if you're just staying active, like you're working those pelvic floor muscles all day long. It's really cool if I like when I hook people up on biofeedback, even like rolling in bed, sitting up, coughing, things make those pelvic floor muscles function. And so usually the key for me is like, let's get the patient back to like they have good control, have good endurance, they know how to find those muscles, get them strong, but then like just general maintain, right? Just keep people active, try to get that 150 minutes a week that everyone recommends of some kind of cardio, do some strength training. I mean, Kegels are a great way. And certainly the thing I love about Kegels is like you can do them anywhere. So you can be sitting at the stoplight and doing Kegels. And so it isn't all Kegels. No, I mean, there's tons of things, but it often doesn't need to just be Kegels because the pelvic floor functions with everything, right? You're working the pelvic floor when you're doing squats.
Mm,
Um, so yeah, I mean, I think the first thing is just like get assessed, see what's going on. Even if you don't have a lot of symptoms, even if you have no symptoms, I Sometimes I see a patient postpartum who's just like, can I just see how things are functioning? Absolutely. Preventative wellness is by far the best type of wellness because then we don't ever end up having symptoms, which is awesome.
Absolutely.
So, short answer, I mean, I think just like everything else, right? Let's stay active, let's stay healthy, let's keep the muscles functioning and doing what they're supposed to.
That's awesome. Yes, definitely. I agree with all of those things. Yeah, and I'm so excited for you to be part of the Creekside team. Yeah, and just population, but you love working with postpartum, other and too like other pelvic floor too, but like yeah, what in general, like what are your ideal patients coming in the door?
Yeah, I mean, I do see such a wide variety. I mean, I think, like I said, postpartum is like my passion. So I love seeing those patients, but those patients end up being patients when they're coming in for an ankle sprain.
Yeah.
Um, thing, I treat the whole body. A lot of TMJ, a lot of pelvic floor, a lot of chronic neck and back pain, but really everything. I
Yeah,
just
yeah.
and
Well-rounded orthopedic.
the preventative I think is super fun. Just get people in there, see how things are going, set them up for success.
Awesome. And I really appreciate you coming on the show today. And I look forward to coming to see you personally.
Yes, I can't wait.
Yeah. All right. Have a great day.
Yeah, you too.
Thank you so much for listening to the Better with Age podcast. It was so great to have pelvic floor specialist Mandy LaBrosse on the show today. If you're interested in connecting with Mandy and exploring some of the realms we talked about today in pelvic floor health and physical therapy, or just overall orthopedic care, she's a wealth of knowledge and she is available to see patients at Creekside Physical Therapy. So if you want to learn more about that, please check out the website, creeksidept.net. Also featuring things on our Instagram and Facebook page as well. If you're curious to learn more about the Better with Age program, the program that Galen and I designed to help people improve their health and increase their longevity. This program will help you improve strength and bone density, heart and brain health, inflammation and gut health. Really teaches you the strategies that you need to improve your sleep and discussing rules around hormones and aging. It's a well-rounded package to help people continue on the health span years of life, doing the things we love. Please check out our website at betterwithage.online and reach out if you have any questions. There's a contact form on the website. Thanks again for listening all the way to the end of the podcast today, and I really hope you have a great rest of your day.